So please tell us a little bit first about liver resection surgery.
Yeah.
How is it used and how does it treat liver cancer?
Yeah, so resection is once again one of the surgical curative procedures that we have for early stage liver cancer. Now, resection is a surgical procedure where one goes in and one removes the cancer that exists and the segments. Typically, you have a margin around there where you remove the liver that is surrounding that liver cancer. This is primarily used for patients who have unifocal, i.e. a single liver lesion that can be any size, but occurs in the setting of a liver that is either non-cirrhotic, i.e. doesn't have cirrhosis, or is functioning well. So it doesn't have any of the complications of chronic liver disease. So if one has a well-functioning liver and a single lesion, this may be amenable to surgical resection where one goes in and cuts this out. Now, the nice thing, once again, this is associated with good long-term survival, actually 5-year survival exceeding 70%. The one limitation of surgical resection is that this is associated with recurrence risk. You leave behind the rest of the chronic liver disease, and so there's a risk of recurrence that can happen over time. And now those patients who are high risk for recurrence typically are being considered for adjuvant therapy. So immunotherapy that's used in those high-risk candidates to reduce the risk of recurrence. And so that's one thing where we've seen some interesting data recently, and one of the areas that we're going to see continued progress to reduce the risk of recurrence. The last thing that I'd say about surgical resection that I find interesting and important is that we've also seen advances in the surgical technique, where one used to historically do this only as an open procedure. But we've seen increased implementation of doing this in a minimally invasive manner, where one can do this either laparoscopically or robotically. So it's done with a smaller incision. And outside of the cosmetic reasons why this is nice, this also helps in terms of improving the time to recovery, reducing the need for blood transfusions, and reducing the post-surgical hospitalization. So improving the time to recovery. So overall, we've seen a lot of advances in terms of our surgical resection delivery and outcomes.